53 people on board now?
Yes, we can start. So over to you, my brother.
Thank you very much. So thank you very much, colleagues, for joining this webinar today. Yesterday, we had a very good round of experience sharing. We had an introduction to the Global Fund architecture, and we also listened to a presentation on unpacking CCMs, funding request development opportunities for CS and community engagement. And today, we are going to go into the Global Fund Community Rights and Gender Strategic Initiative. We want to know what this is, and we are going to get a presentation from Gemma, and then we are actually going to be looking at introduction to the CRG technical assistance, and Brice will give us a presentation on that. And then we shall hear from Yvonne Catherine Kahimbura on information about the Anglophone platform. And then Olivia will come in and talk to us more about the Civil Society for Malaria Elimination platform. And then we are going to have a plenary session where we'll be responding to questions, clarifications, and answers. Feel free to use the chat room. If you have a question, you can put it on the question and answer section, or you can type it in the chat room. You can also introduce yourself on the chat box as well, so that we can know who actually was in the call. So without actually taking quite a lot of time, I would want to welcome Gemma to actually kick us off today with a presentation on the Global Fund Community Rights and Gender Strategic Initiative. Welcome, Gemma.
Thanks, Mlewa, and thank you everyone for inviting me to be part of this exciting training. I'm going to try and speak very quickly so that we save time. These slides can be shared afterwards, so I will not read everything on the slide. I will just go through very fast and leave more time for discussion and my fellow presenters as well. So I'm going to give you a brief overview. Oops, sorry.
Sorry, Gemma, just to let you know, you can so you can actually take your time, because we have received some feedback, and CSOs would like, a lot of CSOs are very new to CRG, a lot of our malaria CSOs. So if you can actually take your time, it would be great, so that they can understand better. And then they can also ask questions. But we have a lot of very new participants on the CRG issues. Thank you.
Okay, thank you for that context, Olivia. Okay, so let me take my time then. I'm going to tell you about the Global Fund's Community Rights and Gender Strategic Initiative. So this is a funding stream outside of the country grants. You may know that the Global Fund invests in national programs, funding malaria responses through ministries of health and civil society, but there are other ways that Global Fund invests in communities that is useful for us to know. So this Community Rights and Gender Strategic Initiative, we call it CRGSI for short, has been going on since 2014. In the first, some people call that NFM, New Funding Model 1, but 2014 to 2016 cycle of funding was the first time we had this money. A $15 million investment for 3 years. Then the Global Fund board saw how well this was working and renewed it again in the 2017 to 2019 cycle. That's what we're in right now. Or rather moving into the third iteration of the CRGSI for the 2020 to 2022 cycle. And now it has been renewed for $16 million. I think what this shows me is that the Global Fund really appreciates the value of community involvement in HIV, TB, and malaria programs. And the fact that they keep renewing this initiative shows that they know how important it is. So what is this initiative all about? The primary objective is to strengthen the engagement of community and civil society in Global Fund processes. That word engagement is very key. So we're not looking at implementing programs, not looking at things like distributing bed nets or distributing medicines or doing testing. No, engagement is about influencing design of programs, influencing decision-making about investments, monitoring and oversight of those programs, influencing policy, things like that. So that's what we work on in this initiative, engagement in Global Fund grants. So we look at it through all stages of the grant cycle, including when countries submit a funding request, when they develop their detailed budgets, when they implement the grants, and when they monitor those grants to see if they were effective. How do we do this? We have 3 interconnected components. I like this slide because it shows them like cogs, wheels. One moves, the other moves, so they're all connected. Component 1 is a technical assistance program. And Brice will tell you more about this right after me, but it's a short-term program where another civil society organization will come and support you with a consultant who can help you with things like consulting your communities or developing a position paper or coming up with your priorities for funding. Things that will help you engage, like I just described, things that will help you influence decisions about Global Fund money, or things that will help you monitor Global Fund grants. So that technical assistance is really just support, but it comes from other CSOs. That's the nice thing about this model. The second component is longer term capacity strengthening of HIV, TB, and malaria organizations. So this is really supporting the strength and sustainability of civil society groups, especially those that represent key and vulnerable populations affected by the 3 diseases. The last component is the regional platforms. So these organizations, Yvonne is going to talk about that afterwards, but these are really meant to help coordinate civil society and communities, but also to make sure information is getting out. Information is packaged the right way, translated in the right language, made short and understandable, things like that. So how does this work? I really like this theory of change because it shows us how this works together. So this is our theory of change. This is our bicycle, our blue man on the bicycle. The point of this initiative is for catalytic possibilities. So like I've said, the main way the Global Fund invests is through large multi-million-dollar grants to countries. And those are going mostly to ministries of health, but also civil society organizations. And those are for the things you may be more familiar with, like I said, bednet distribution, testing, information and awareness in communities, those programs. What we do is make those programs work better. And we believe that if communities are engaged in those programs, they will be more successful. So here's our backpack. This is our technical assistance, short-term technical assistance. It's like, what do you put in your backpack? You take things you need with you for the journey, food, water, maybe a map. These are your tools. And then our wheels are the other components, the long-term capacity strengthening of organizations working in TB, malaria, and HIV, and the regional platforms who share information, make sure communities access support, and bring it all together. Then we have the bicycle, which is our way of moving around, where we have trainings like this one, tools and guidelines. Yvonne is going to talk about those as well, and monitoring and evaluation. And if we put all this together, we believe we are on the road to universal health coverage. So Brice will talk about the short-term technical assistance program. So I won't go into too much detail so I don't step on his toes of his presentation. But some of the main activities, the main kinds of support that you can access is around situational analysis and needs assessments, So maybe we need to do a scan of, what are the actual needs of malaria civil society organizations in your country? What do they need to engage? Do they need coordination support? Do they need information? Do we need training like this one? Do we need mapping of each other? Community consultations is also something we support, bringing constituencies together, discussing key issues, coming up with advocacy agendas or plans. Also support to make sure people can engage in program design, budgeting, writing. The Global Fund can be very technical sometimes, and it can be very useful to have support with you to develop budgets, to develop write-ups, and to develop activities. We also support monitoring and evaluation, like helping to engage in watchdogging or other forms of oversight, and some other relevant areas. What I want to highlight on the right is the number of assignments that we've supported for each disease component. So you can see when you look at that the majority of the support is still going to HIV organizations or HIV-related assignments. Quite a number for HIV and TB integrated, but you see we only have delivered 14 assignments related to malaria support. Now, it's a demand-driven model, so people need to request the support in order for us to give it. So what this tells us is that there are very few malaria organizations asking for this support. So I hope that after this event, we may receive more demand for technical assistance from malaria organizations. The second component, which is the long-term capacity strengthening of key and vulnerable populations, is done through grants to these organizations that you can see listed there. Organizations and networks. So these are grants for things like network strengthening, building capacity of network members, also advocacy for investments, advocacy at national, regional, and global levels, and supporting these networks to reach out and effectively engage their members. So you can see malaria is part of this in a meaningful way. In the first cycle of the CRG-SI, we did not have malaria organizations receiving support. So this is new as of 2017. And we're quite happy to see the great progress that's been made there, but we also know we need to improve further. So what are some of the activities we've supported for malaria organizations? So we supported, there were eight countries where activities in malaria took place. And including some examples here, in Cameroon and Nigeria, Malaria No More pre-tested and validated a community guide for CSOs on the inclusion of gender, vulnerable people, human rights, and social rights in the fight against malaria. Lastly, we have our regional communication and coordination platforms. So like I said, this is really about enhancing knowledge, so sharing information. You can see our colleague Ida Savadogo in the bottom there, sharing information with other colleagues in Francophone West Africa at a conference. So it's about materials and translation and packaging of information, but also making sure communities have access to technical assistance. What's interesting to note is that 60% of all the technical assistance demand that came into the Global Fund, the regional platforms helped to develop those requests. So if you feel a little overwhelmed with what is technical assistance, I don't know how I access this, these 6 organizations are there to help you. They can help you come up with an idea, identify your needs, they can help you write the request, they can help you come up with the activities that you need support for. So I really encourage you to lean on these organizations. IANASO, you can see, is there. And IANASO is a co-host of this webinar. So they are the regional platform for all the English-speaking African countries, Anglophone Africa. So they are there to help you. So one of the key areas I want to zoom in on is around investing in community system strengthening for malaria control and elimination. So you can see there's been quite an effort from the Global Fund CRG-SI to try and assess and address inequalities related to human rights and gender barriers for community services, for malaria services. This is really to make sure that interventions are focused on those populations left behind. We're in the area of the Sustainable Development Goals now, so we know nobody should be left behind. So underserved populations, in malaria context, this may include people like pregnant women, refugee women, people who live in, or people who are internally displaced. Some people who live in rural areas have very little access to health information and services, things like that. So the Malaria Matchbox tool is something that we've been piloting as part of the CRG-SI, but we hope it will also be taken up in broader contexts, including in Global Fund grants going forward. The Matchbox tool helps to identify and address human rights and gender barriers to services in relation to malaria, looking at who are the populations most affected, what are the key barriers they face, and how malaria programs can address those barriers. You can see the link is there, so you can access the tool in English and French after the webinar. So here's just a highlight of the kind of analysis that the tool helps you have insight to, looking at potential underserved or high-risk groups, mapping what aspects of the malaria response they may have limited access to. So this is just giving you an oversight. And then some of the potential inequalities and barriers that these populations face when it comes to accessing information, preventive therapy, and case management as well. Some of the key outcomes. We've supported the piloting of this tool in India, but also in Niger and Guinea-Bissau. So what are the highlights? In Niger, there was action planning to address the needs of rural women. So women who are living in places far outside of the big cities in Niger. How can we address the barriers that these women are facing, especially those that relate to gender norms? In many of our countries, we know women are not allowed to access certain health services without permission from their husbands or fathers. So similarly in Guinea-Bissau, the tool really revealed the need to really plan to include populations such as fishermen, immigrant communities, and certain children from a relevant tribe as well. So, and also action planning to see how communities living in the islands can be part of the national response and access services. We recently did an evaluation of the CRG-SI to see what lessons can we learn, how can we improve for the next cycle. And I just want to highlight a couple of the findings that relate to malaria for this group. So our evaluation told us, it's great that you included malaria organizations, but you need to increase the resources and the differentiated support. That means the special tailored support for meaningful engagement of malaria-focused communities. What this is telling us is you can't treat all organizations the same. An organization working in HIV is not the same as an organization working in malaria. We have different information needs. We have different levels of engagement, different barriers, all of that. So they're saying invest more money and make it more tailored and relevant to malaria groups. What else? So they still say there's an action needed. So despite progress and having 3 malaria organizations benefiting from this support, the work remains more challenging, and we need to work more closely with the RBM partnership, formerly Rollback Malaria, as well as the Global Fund's malaria specialists. So we need to really harness the technical partners and the Global Fund's technical support to make sure we are working together. And that's what we plan to do for the next phase. So watch this space. Starting in January 2021, we will have a new 3-year phase. Same 3 components: technical assistance, long-term capacity strengthening of organizations, and regional platforms for communication and coordination. But we really hope to see an improved engagement of malaria communities in all of this. So looking forward to hearing your thoughts, and thank you for the invitation to speak.
Thank you, Gemma, for that really detailed and elaborate presentation of the CRG strategic initiative. And I know you had informed me that you would be leaving at some point. So instead of continuing with the other presentations, I will give the team some 5 to 10 minutes to just raise any questions if they have any questions regarding your presentation, so that you can be able to have time to address them before your time to leave us during the call comes. So team, if there is any question to Gemma, please feel free to respond or to answer, to ask. Olivia, if you can see hands from your side, you can support me in coordinating, taking the questions.
Yes, yes, absolutely. Thank you very much, Gemma. We appreciate how you presented it. And I think it's very, very, very clear. And we will also share that video with other malaria CSOs who couldn't make it today. So thank you for the great presentation. So yes, we have 3 people lining up for questions. So we will start with Kennedy. So Kennedy, you can unmute you can activate your microphone and speak. And after Kennedy, we'll have Silas, and then we have Isaac. So Kennedy, go ahead, but you can unmute your microphone, please. Yes, Kennedy, go ahead.
Hello, good morning.
Yes, good morning. Please go a little bit quickly.
My question is that most of the people that we contact complain that sleeping under a mosquito net is very, very difficult. And when they sleep, the temperature keeps on increasing. Very difficult. You don't know how to convince them. So if you can help us, the words we can use to convince them. Thank you.
Okay, thank you. That's a great question. So it's very difficult to sleep on the net. How do we convince communities to use mosquito net properly? So Silas, go ahead, Silas Spencer, you can speak now. Thank you.
Okay, thank you very much, Olivia. My pleasure to be here. Just straight to the point, how do we plan to increase male participation in malaria prevention? Because most men feel that it's an issue of the woman. They are stronger, so they can overcome any kind of sickness, and they end up not sleeping in the net. And if you are not in the net, you can be infected and infect your household again, like a cycle. So how do you plan to actually develop a gender-focused intervention that carries them along and see that they are also an active component in eradicating malaria, especially from other experiences and going on forward? Thank you.
Thank you very much. Thank you, Silas. So Isaac Ampoma. Isaac, go ahead, you can speak.
Yeah, thank you very much. This is a very nice discussion. My question is to the ENASO as the regional bloc. How accessible is ENASO to provide capacity? Does it mean we have to request for ENASO to come to in-countries to help us with our regional proposals and in-country proposals for some technical support? Thank you.
Thank you very much. Very good question. Thank you. And the last question is Joseph Wato. So go ahead, Wato, you can ask your question.
Okay, thank you. I just want to ask maybe the same question as the one who just speak, but I would also ask the question: is it possible for several organizations in, I mean, from 2 to 3 countries to look for technical assistance, put themselves together and look for technical assistance. I mean, if I'm an organization in Cameroon and can I join with an organization in Nigeria and Congo to look for technical assistance and so on?
Okay, thank you very much, Wato. I'm just checking, we don't have any more hands. So Gemma, over to you, thank you.
Thank you all for the excellent questions. I think the first 2 questions are not ones I have an answer for now, but these are the kinds of things that I think the Global Fund's technical assistance can help us to think about. You know, how do we convince people to sleep under a net? And also how do we boost, you know, male engagement in our programs? You know, I think these are the kinds of discussions that, you know, our technical support could enable a bunch of people to come together, communities engaged in program delivery, and discuss these strategies, consult each other, consult communities, and come up with proposed ways to reduce these barriers to access, and then make sure this advocacy is reaching the people who make decisions about Global Fund grants. You know, that's the kind of thing that we can try and help communities think through, and help make sure that, that those solutions are reaching key decision makers. So I would encourage you to think about, you know, a community consultation where solutions to these issues could be discussed. And that's something you could ask technical assistance to support financially and with a facilitator and things like that. So ENASO is based in Tanzania, but they serve all the English-speaking African countries, including those in West Africa. They have a focal point in Nigeria. So they have an organization there who helps engage West African communities. But I think a lot of the support from ENASO is done remotely. So if you wanted to access technical assistance, you can have a Zoom call with them. They can help you write the request over email, making comments, and they do that all the time. There is some in-country support available through the platform. So that's another way that the platform engages. I'll let Yvonne rather talk to that. And lastly, for countries coming together to request technical assistance, the point of the technical assistance is to help communities engage in the national Global Fund grants. So like I said, the Global Fund invests in national programs. So they will have a grant to Cameroon. They will have a grant to DRC. And that's where most of the money goes. Now, there are multi-country grants. I think for malaria, there's one in the Sahel region, I think. So, and some in East Africa as well, looking at refugees. But for the most part, the engagement is happening at the national level. So I think I would encourage you to reach out to ENASO and seek their advice. But most of our technical assistance goes to support national level engagement. I think that's all, Olivia.
Yes, thank you, Gemma. We actually have just a few additional questions from the Q&A box. So if it's okay, we'll just take maybe 2 more minutes of your time. So we have Tumaniel from Tanzania asking, saying that I'm very much curious to know more on these 2 components in relation to the Global Fund program, research and data, and how CSOs are well centered and engaged. So anything to say about research and data. And then we have Sarah as saying that in her community, women and young women have fear to access health facility because of coronavirus. So is there any way they can be helped to take away the stigma? And yes.
Thanks, Olivia. So I think I can answer the...
Sorry, just one more just came up. By Chimanawa saying that there have been challenges in engaging local CSOs in concept node development. How did you prepare to solve these challenges and ensure that local CSOs are engaged and facilitated to access global funding for malaria, HIV, and TB program. So in terms of accessing funding for local CSOs in the Global Fund concept note. Thank you.
Very good questions. So I think I can answer the first one about data and research at the same time as I answer the one about whether this includes Zimbabwe. So one of our technical assistance assignments last year supported a network of women living with HIV in Zimbabwe to conduct research with their other members of their network, other women living with HIV. They were supported to do a research study looking at barriers to accessing viral load testing mostly. So yes, the technical assistance can support community-led research projects, short ones, especially if the findings of that are used to influence Global Fund grants. So yes, Zimbabwe is eligible, and there's an example from Zimbabwe where research and data support was provided to a community group. Yeah, the question about Corona is a big challenge, eh? It's a challenge for everyone, I think, around the world right now. Again, I think all I can say is that technical support can help us come up with these answers, either through consultation or through expert support. We are still providing technical assistance even with coronavirus, so a lot of it is done remotely or with local consultants only, so maybe that can be an option. The last question is a very good one. This is one of the main reasons for why the strategic initiative exists in the first place. We noticed that in the rounds-based system in the olden days of the Global Fund, most of the time it was just Ministry of Health writing these things in a room and sending it off. Nobody knew what they were writing. No one knew. Those days you had to post your concept notes, not by email. People had to run to the post office with piles of paper. But in any case, communities, civil society were not very well engaged. That's part of the reason for this investment, to make sure that people are supported to engage. So technical assistance absolutely would support civil society and communities to engage in the concept note development. The regional platform also provides support for this kind of thing. And I know that the component 2 networks, the long-term capacity building, they support engagement on writing teams. They provide mentorship with how to write the concept notes. So there's a lot of support for that kind of thing through the strategic initiative. Again, if you are in English-speaking African countries, I think ENASO is a good starting point, and they will tell you whether it's best supported through technical assistance, or they can refer you to CS4Me, or they can refer you to another TA provider. But you know, this can be supported through things like mentorship for how to write the concept note. It could even support people to be on writing teams, like transport to go to and from the writing team meetings. I know that can be a barrier sometimes. So there's different kinds of support available. Or, you know, maybe sometimes you need a civil society consultant who can really be the neutral mouthpiece and bring forward those issues and package them in the right way. We've done that in the past. So there's lots of ways that this can be helped. Thanks a lot.
Thank you very much, Gemma. I think that's it for the questions. If anyone has more questions, you can always send it to us by email. You have the email at the end, and then we'll be happy to send the question to Gemma. Thank you, Gemma. Thank you so much for your time. So Merwa, over to you.
Thank you so much, Olivia, and thank you so much, Gemma. There were a couple of other questions on the main chat, which I'm happy will be addressed by the other speakers who are coming in. For instance, there was one from Eva Muthuri from Kenya, who is saying we are actually at the tail end of the funding application process, and I would I would like us to engage in the final stages of the application. How can you help? This is Eva Muthuri from Kenya. Yes, we are going into the section of actually TA, and you are going to learn more on how you can actually be able to engage even at this time, and how you can actually be able to apply for TA and for effective engagement in the fund request process. There was also another one from Jonathan, who is saying, I'm Jonathan Tekaya from Ghana, president of Ghana Coalition of NGOs in the Greater Accra region of Ghana. Please, how can we access technical assistance as we network in Ghana? And yes, Jonathan, this will be addressed quite adequately by both Bryce and Yvonne as they come in to speak. So I've just read some of the questions and comments that are on the main chat box, and this will be adequately addressed by our next speakers. So at this particular point, I would wish to ask Bryce to come on board to talk to us more about the CRG-TA. There is a lot of interest and enthusiasm from the group about TA, and I'm sure this is a section that many will find useful on how they can actually be able to engage, and later Yvonne will highlight how ENASO and the platform can really be able to reach out to communities and support them to deliver quality TA requests to the CRG. Bryce, welcome.
Hi, thank you very much. I'm actually trying to see where to go to upload my presentation. So just give me a second, please, if you don't mind. I'm not quite used to Zoom. Okay, found it. Yes, all right. Okay, again, good morning, everybody. Thank you very much to ENASO and Impact Santé Afrique for organizing this webinar on malaria. And thank you very much to all the representative of the community organization and civil society organization that are working on malaria. So again, as my colleagues from ENASO have mentioned, my name is Brice Bambara, and I'm in charge of coordinating technical assistance at the Community Rights and Gender Department of the Global Fund. So I am going to be walking you through what the technical assistance program of the Community Rights and Gender Department is, and I'm going to explain to you who can access it, how to the type of activities and support that we can provide, and also tell you a little bit about the type of organization that are providing the support under the technical assistance program. And I'm also going to give you some example of support that malaria community organization can request, and also a few examples of support that were already provided in terms of malaria related intervention. So GEMA has already done a really good job in telling you what the Community Rights and Gender Strategic Initiative is. And the technical assistance program is one part of the strategic initiative. And as she mentioned, this picture there speaks really well, because the strategic initiative has three different components that work together to make sure that community engagement in Global Fund related processes is strengthened. So, and the first component here, and the one that I'm going to be focusing on, is the short-term technical assistance to community and civil society organization. And this is a mechanism that the board approved back in 2014. And the main reason for that was because one thing that the organization had realized was that it was very important, if we wanted the response to the three diseases, HIV, tuberculosis, and malaria, to be more impactful, there was a need to involve all actors, including civil society organization, community-based organization, and also key population. And the one thing that was also noticed was that while we want these communities to be involved, unfortunately, sometimes, you know, they don't necessarily have the resources to have access to the knowledge and the information that they need to actively be involved in Global Fund related processes. So there was a need then to think of a way to provide some support to them so that they can actively engage. So this is one of the reasons why the strategic initiative was created, and the technical assistance program was put in place to actually help communities and civil society organizations to be more prepared, to be equipped with the tools that they needed to be meaningfully engaged in Global Fund related processes. And here I say Global Fund related processes because you have some processes that happen in countries that are nationally owned, like the development of the National Strategic Plan for HIV, the National Strategic Plan for tuberculosis and malaria, that are processes that are owned at the country level, but upon which you know, the funding request development and the subventions, the Global Fund subvention grants themselves rely heavily. So there was then, again, a need for support to be provided to community groups, and this is what the technical assistance program is here for, to make sure that all the people that are affected by the 3 diseases can play a meaningful role in Global Fund related processes, so that we can actually address the barriers that prevent a lot of marginalized communities to have access to health services. So now, the technical assistance program saw an evolution. From 2014 to 2016, support could only be provided for country dialogue and funding request development. And then when the first part of the strategic initiative ended, we realized that there was also a need to extend the scope of the strategic initiative and also the technical assistance program to also be able to provide technical support beyond the funding request development stage. So the scope of the technical assistance program was extended so that community and civil society organizations could access technical support throughout the grant life cycle. So now not only is country dialogue funding request development covered, but we also provide some support during grant making and grant implementation as well. Okay, and now who can have access to the Community Rights and Gender Technical Assistance Program? One thing to mention, because it was one question came up in the group asking, for example, what country were eligible, if Zimbabwe was eligible. So I want to let you guys know that all the countries that are eligible for Global Fund funding can apply for technical assistance. They can apply to receive technical assistance. And we strongly encourage, again, as I mentioned, it's for meaningful engagement of communities. So civil society networks and organizations are strongly encouraged to apply for technical assistance. Key population networks and organizations, including youth-led networks. Networks and organizations led by women are also eligible for technical assistance. And any network and organization of people that are living with or affected by the 3 diseases, so I mean HIV, tuberculosis, and malaria, can also apply for technical assistance. One thing that I need to specify though is that we do not really accept requests for technical assistance from the CCMs, from the country coordinating mechanism, unless these requests are developed and submitted in collaboration with some of the organizations that I've mentioned before. Okay, and again, because the technical assistance is designed to influence, the national strategies and decision making, we usually give priorities to the requests that are received from countries as opposed to regional requests. But then again, we do provide support for requests that are covering more than one country. So, because I know that someone had also asked a question about regional support. So if you're an organization that has, let's say, representation in different countries and you feel like you need some technical support, for example, to identify priorities in terms of access to services for malaria in the different countries where your organization works, please do submit a request that will have a regional coverage, and we will review it and see the best way to actually go about providing the terms of support that you need. So again, as I've mentioned, the technical assistance program covers all 3 diseases, HIV, tuberculosis, and malaria. Over the past few years, during the implementation of the technical assistance program, we've received a lot of requests for technical assistance from organizations working mainly on HIV and tuberculosis, and unfortunately not as much from organizations working on malaria. But then again, there has been an increase because from 2014 to 2016, we had received 0 requests for technical assistance related to malaria. And from 2017 to 2019, we've actually observed an increase because we've received 14 requests for technical assistance related to malaria. So now, again, as I mentioned, it's very important to, again, emphasize the fact that technical assistance is available for meaningful engagement of communities in Global Fund-related processes throughout the whole grant life cycle. And I'm saying this because, again, one of our colleagues from Kenya had mentioned the fact that Kenya is near the end of finalizing the funding request, and they wanted to know how they could be involved to this in this final stage. And one thing that I want to say is that if you the stage of the funding request development is really advanced, it might not be the best time for you to actually engage in that process. But then, after the funding request is submitted, the funding request is reviewed by the technical review panel, and then the country, Kenya, will be going through grant making. So, and the grant making stage is this stage where you're looking at the intervention, you putting aside some money for them, and you actually see how you're going to go about implementing this intervention in countries. And this is also a great opportunities for communities to actually come together and prepare themselves so that they can meaningfully engage in the grant-making process as well. So, and there's also possibility to ask for technical assistance during the implementation of the grant as well. And I'm saying this because what happened is that most of the time during the implementation phase, there's what we call reprogramming, when there's been some savings that have been identified, and then the country team working with the CCM go through this process where they actually try to identify some activities that were not budgeted for when during the grant making stage, and that they can now finance during the reprogramming of the grant. So again, this is a great opportunity for civil society organization as well to be able to come together, identify some priorities, prioritize them, budgetize them if necessary, so that they can then present them to the CCM and all these other entities that are involved in the programming, so that, you know, when funds become available, these activities can then be funded through the grant. So now, in terms of, I know I've been broadly telling you the type of support that you can get, but now I'm going to give you some very specific examples. So in terms of support, we have 5 main areas of technical assistance that the program covered, and Gemma briefly mentioned them, but we do provide some technical assistance to conduct situational analysis and needs assessment. So, and the reason why we do that is because we want to make sure that civil society, key population and communities more broadly have access to all, you know, the information, the evidence that they need to make sure that the funding requests that are going to be submitted actually reflect the issues that these communities are facing and respond properly to these issues. And that, you know, there's like a really strong focus that is given to the grant in terms of responding to the needs of the communities affected by the diseases. So now when we talk about situational analysis and needs assessment, as Gemma mentioned, you can request technical assistance, for example, to do a mapping of community-based organizations, civil society organizations that are working in malaria. Okay, how many organizations working in malaria do we have in the country? What type of services do they exactly provide in terms of malaria, and how can this organization like work together in a more efficient way to make sure that the response to malaria is more impactful. So you can request technical assistance to be able to do this sort of activities, do some mappings, for example, to also assess the level of involvement of your organization in the response to malaria, for example, to see if community organizations working in malaria, for example, are sufficiently involved in the national malaria responses, for example, and if they are not involved, why is it the case, and how can we make sure then that these community organizations are included in a more effective manners. So, and one thing that you can also do is request technical assistance to conduct a community validation of key population size estimate. So in malaria, correct me if I'm wrong, I think we talk more about vulnerable population, but in certain contexts where, for example, you have migrants and mobile populations, you know, you might have numbers in terms of this population. How many are they? What's the level of support and services that is needed to, you know, help them fight malaria? But then sometimes this number that you have, you know, they're not confirmed. You're not sure if they're the right numbers because you can have different numbers from different organizations, and then there's a possibility for your organization to request technical assistance to go through an exercise where with a consultant, you're going to look at the different sources that are available and come up with the more realistic numbers so that you can strategize using this number for a better response. Another area where you can request technical assistance is to engage in the country dialogue. So some of your countries have already submitted their funding requests to the Global Fund for the TRP to review them. Some of them are currently finalizing the funding request, but some of them have started the country dialogue process. So it's a good opportunity for organizations that are working in the malaria response to request technical assistance so that they can come together, look at the previous grants, for example, that were implemented during the previous cycle, to then see what was missing before and what should be included in the upcoming funding request that your country is going to be submitted to the Global Fund. So it's a good opportunity for you to access technical assistance, to bring together all representatives from organizations working in malaria to sit around the same table and think of those activities, intervention programs that you think needs to be included in the funding request for a more impactful response to malaria. And when we talk about engagement in country dialogue, we also talk about strengthening your knowledge of the Global Fund model of work. And as Gemma mentioned in her intervention, we understand that, you know, we use a lot of technical terms that are not necessarily easy to decipher. Even myself working at the Global Fund, sometimes I'm like, wait, what? Like I would need some colleague to walk me through some of our technical terms, some of our technical briefs, some of our processes. And so when communities request technical assistance to engage in country dialogue, we usually also use this opportunity to strengthen your knowledge on Global Fund processes. So to explain to you how getting funding from the Global Fund works, what are the processes that the different entities that are involved in the Global Fund work go through. So, you know, we walk you through the funding request development, the grant making process, the grant implementation, and all these different processes. And again, there's also the possibility for you to request technical assistance to actually do a review of the funding request. Again, it provides you with the opportunity to look at the funding requests that are going to be submitted and see what are the gaps and what are the needs, so that working with a consultant, you can come up with recommendations to strengthen the different programs. And one other area where you can request technical assistance is to inform program design. So again, in this area of work, technical assistance can be provided to support communities and organizations to design, plan, and also budget for some intervention that should be included in the funding request. And the reason why I put an emphasis on the budgeting part is because sometimes, again, a lot of community organizations know what intervention, what activities need to be included in the funding request, need to be implemented to make sure that, you know, more people are reached with services, health services to help fight malaria. But then when these information are presented to the writing team, for example, they will be more impactful if you're able to be like, okay, so we think that this intervention should be implemented, and this is how much it's going to cost. So it's not as expensive as you think that it is, but it will have a bigger impact than if it's not included. So then you can request technical assistance to help you go through an exercise of prioritizing some intervention and even put together a budget for this intervention so that they can be taken into consideration when the funding request is being developed. Two other main areas where technical assistance can be provided would be to support the oversight and monitoring of the grant implementation, and also during reprogramming, as I'd mentioned before. And the last area of technical assistance is to allow communities to engage in sustainability and transition strategies, but I don't think that this one really speaks to you, because I don't think that any of the countries that you are from are going to be going through a transition anytime soon. So in terms of the organizations that are providing technical assistance, at the beginning of the strategic initiative cycle, we had a request for proposal that helped us identify and pre-qualified some civil society and key population network and organizations that will be serving as technical assistance provider. And we have 26 of them, and they have a capacity to deliver support in gender issues, human rights barrier to access to services in the 3 diseases, so HIV, malaria, and tuberculosis, and also support civil society in a challenging operating environment. And when we talk about challenging operating environment, we're talking about these countries that face more hardship than others. So, for example, countries that are going through political instabilities, for example, or countries that maybe have a health system that are rather weak because they were maybe going through some health crisis before, and now they're sort of rebuilding themselves and things like this. But in the Global Fund website, we have a list of countries that we consider being a challenging operating environment. But again, and the role of a technical assistance provider is to work with communities, organizations that have requested technical assistance to actually help facilitate the whole process. So once a request for technical assistance is received and we've reviewed it and it's eligible, the technical assistance provider work together with the civil society organization that has requested the technical assistance to help coordinate the delivery of the technical assistance. So they will discuss the scope of the technical assistance with you. They will help you put together a budget. They will help you identify a consultant that is going to be working with you on the technical assistance. And they are the one that, will oversee the good implementation of the technical assistance, so that if there's any issue, they can report to the Global Fund so that we can see how we can address this. So now, how can you access technical assistance? So in that slide, you have a link that will take you to the Community Rights and Gender Technical Assistance Program, where you have access to a technical assistance request form. You have access to a frequently asked question documents. You have access to the list of technical assistance provider. So, and when you go to that website, you can download the application form and fill it out. And this is where the regional platform like IANASO play a really important role, because we actually strongly suggest that when you think about submitting a request for technical assistance, that you get in touch with them, because they are a really great source of information, because they will help you by discussing with you, identify clearly what your needs in terms of technical assistance are, and even help you fill out the request form, and will serve as a middle person in terms of having discussion with the Global Fund. So the EANASO and the regional platforms are really good at getting in touch with us at the Global Fund to follow up on the status of a request that was submitted by your organization. So please go on the website, look at the informations that are available on the website, and reach out to the colleagues at EANASO with any questions that you have, because again, like I said, they usually have all the answers to the questions, and if they do not, they will get in touch with us with the questions so that we can provide answers to make sure that you have the best support needed to submit some requests for technical assistance. Okay, so, and usually from the time we receive a request for technical assistance to the time the request is, the technical assistance is ready for implementation, it can go from anything from 4 weeks to 8 weeks. And but then again, depending on the level of urgency and how easy it is to identify a consultant, the process can even be shorter. So I'm realizing that I've been talking quite a lot, and I'm not necessarily great at giving presentation, but I will end here, and I will, oh yes, sorry. I was also supposed to give you an example of activities that are implemented under technical assistance. So again, I mentioned some of them before, but you need to know that you can get technical assistance to conduct assessment of human rights and gender-related barriers to access to services. Again, like I mentioned before, mapping of communities and civil society organization. You can get technical assistance to identify and prioritize intervention and activities to be included in the funding request. And you can also access technical assistance to convene communities consultation to discuss, learn, and plan for civil society engagement in key Global Fund related processes, including national strategic planning for the different diseases that you involve in. And in terms of specific technical assistance relating to malaria, as I mentioned before, during this cycle, we've actually been able to support 14 assignments related to malaria. So in Kenya, for example, we provided technical assistance to a community-based organization to participate in the finalization of the malaria funding request and in the design of the malaria program. Still in Kenya, we provided some technical assistance to support the review of a comprehensive malaria funding request. So we provided support so that there could be a mock TRP where some organization from countries came with some funding requests, and we had hired some technical experts that went through those requests with them to see if the requests were strong, if all the interventions that were included were the right one, if the rationale for this intervention was also strong and technically sound. As Gemma has also mentioned, that malaria matchbook tool that was created last year, and technical assistance was provided to pilot the malaria matchbox tool in Niger, India, Somalia, and Guinea-Bissau. In Sierra Leone, we providing technical assistance to key population network to identify key priorities for people affected by the 3 diseases, so including malaria, to inform the upcoming funding request. And in Bangladesh, we are currently discussing providing technical assistance to civil society organization to conduct an assessment of the refugees' needs in accessing malaria services. So I'm going to stop here, and I will happily answer any questions that you have regarding the information that I have just presented. And again, apologies if it was very much condensed, but I will gladly take questions. And if I do not get to address them all during the Q&A section, feel free to get in touch with me or with my colleagues at IANASO, and they will be able to provide answers as well. Thank you very much.
Thank you very much, Brice. Thank you very much for that really well elaborated presentation. I believe there will be a number of questions later because your presentation aligns quite well with Yvonne's presentation as well. I will call upon Yvonne to make her presentation, and then after we will also listen to Olivia. Then we will have now a broader Q&A section. So participants, feel free to keep loading your questions on either the question and answer section, or we will actually have a section to deal with the questions and answers after the 2 more presentations have been done. So I want to bring in Yvonne now. Yvonne is actually from IANASO and is part of the Anglophone platform, and will be telling us more about the work of the platform, and probably also tell you more on how you can be able to reach out to the platform, or how the platform can also be able to support you. So Yvonne, welcome, introduce yourself well, and continue with the presentation.
Thank you so much, Mlewa. Hope you can hear me.
Yes, very clearly.
Okay, just a second so that I can share my screen. Okay. Okay, Mlewa, can you see my screen?
Yes, I can see your screen, Yvonne, very clearly.
Okay. Okay, thank you so much, and just want to take an opportunity to thank the presenters, Brice and Gemma. Greetings from Tanzania, Arusha. My name is Yvonne Catherine Kahimbura, and I'm the Policy Watch and Advocacy Team Leader. I work with the IANASO, and as Mlewa has said, I'm part of the CRG Anglophone Africa platform, which is hosted by IANASO, and very, very glad to be on this platform to share with you about the community rights and gender platforms, what they do, what is their role, who are the platforms, and which organizations host these platforms. I know Gemma talked more about the CRG, community rights and gender, as well as Brice talked about one component about community rights and gender. And for me, I'll basically be diving deep into more about the regional platforms. What are the platforms and what is their role? Yeah, thank you. Yeah, so as I've already said, Gemma already introduced to us what is community rights and gender. And for me, I will just briefly talk about the platforms. So the CRG strategic initiative is a 15 million initiative which aims to strengthen meaningful engagement of communities in all global fund processes, as Gemma has already told us. Just to allude and emphasize more on the component of community rights and gender, as we all know that the Global Fund admits that activities to fight AIDS, TB, and malaria cannot be successful without significant participation of civil society and also key affected population. So what the Community Rights and Gender does is to ensure that the civil society have more information and knowledge and are able to influence decision, as well as pay attention to human rights programming, intervention, gender barriers, as well as community system strengthening. So this is how the platform comes in to support communities and civil society to ensure that they engage meaningfully in global fund processes at national and regional level, and with much emphasis on these components, which is community system strengthening, human rights, and gender intervention, as well as programming. So I'm not going to talk much about this because Brice and Gemma have already talked about the 3 components of the Community Rights and Gender Strategic Initiative. So for me, I'll just be taking you through the regional platforms for communication and coordination of the Global Fund processes. So IANASO was pre-selected, that is for the period of 2017-2020, to host the regional platform for communication and coordination on HIV, TB, and malaria, and that is for Anglophone Africa. And the coverage is 25 countries, including Lusophone, the 25 countries, English-speaking countries, including the Lusophone. These are the Portuguese-speaking countries. That is Portuguese, that is Angola and Mozambique. So that is the coverage area, the countries that we support as Anglophone Africa platform. So IANASO works hand in hand with Focal Point Organization. We have in Southern region, which is hosted by MANASO, based in Malawi, and Vincent is on this call. After maybe you get an opportunity to say hello to colleagues, and this is a very good opportunity for Vincent to touch base with colleagues. And then we have another Focal Point Organization based in West Africa, that is by JAIDS, that is Journalism Against AIDS, based in Nigeria, in Lagos. And these are the contacts in case you want to reach out to them, because they do really support us a lot of work in those regions. Sometime back, we did a needs assessment survey to find out from civil society and communities on how best Anglophone Africa platform can serve the communities and civil society. And one of the recommendation, or one of the concern, was that IANASO is based in Tanzania, which is in East Africa. So they had this request that we need to reach more organizations and civil society in Western and Southern Africa. So that's how we came up with this Focal Point Organization to support in our work that we do as Anglophone Africa. And these are the contacts for IANASO, Lewa, and myself, Yvonne. You can always reach out to us in case you need further information. I thought this would be very key to include these contacts in this presentation, so that after this, we can touch base with the malaria constituencies. And just this is an opportunity. We have not really, I'm going to be honest, in the past, we have not really done a lot engagements with the malaria constituencies. And this is really great to have this partnership with Impact Sante Africa to ensure that we include and to ensure that we bring on board malaria communities to engage meaningfully in global fund processes. So there are 6 regional platforms that hosts the CRG platform, and one is Anglophone Africa, which I've already said that is hosted by IANASO. We have Asia Pacific, which is hosted by APCASO. This is the region that is in Bangkok, Thailand, and other countries in Asia Pacific. And then we have the Francophone Africa. This is basically for the French-speaking English. My French is not good. I just know only bonjour, ça va bien, that's it. So we have a platform again for our colleagues in Central and West Africa. And this is hosted by Rame, which is based in Burkina Faso. And then we have Eastern Europe and Central Asia, hosted by Eritrean Harm Reduction Association. And then we have Latin America and the Caribbean. And then we have the Middle East and North Africa, which is hosted by MENA. So all these organizations, we have the same objectives that guide us in our work to ensure that we support civil society and communities to meaningfully engage in global fund processes. So these are the 4 objectives, as I've already said, that guide us in our work. One is to further the meaningful engagement of civil society and communities in global fund processes through bi-direction communities, communication, and provision of accurate and accessible information. I'll talk about this later, give examples of the activities that we do under this objective 1. Objective 2 is to improve the overall impact of global fund programs and intervention. And we do this through strengthening engagement of civil society and communities affected by HIV, TB, and malaria. Again, I will talk more about it. How do we support communities to engage meaningfully in global fund processes? And then the third one is expand access to technical assistance for civil society and communities. I think Bryce has taken us through the first component of the CRG, which is CRG technical assistance, and the role of the platform. I'll also explain how do we come in to support this initiative. And then lastly, we also support strategic civil society and community capacity development initiative through fostering spaces for engagement and collective participation in key decision-making process, and in particular as they relate to community rights and gender. Again, this is a very good objective, which also ensures that civil society and communities have space to engage in decision-making processes. A good example is the recent ongoing process of the Global Fund strategy development. And I know Lewa, you'll be able to share with the team, the colleagues that are on this webinar, the survey question on a global fund strategy. The global fund strategy ends in 2022, and so there's a process of developing a new strategy, which will begin in 2023. So the platforms are really engaging communities and civil society to provide inputs, recommendation, which can be incorporated in the next global fund strategy. So these are the 4 objectives that guide all the platforms to ensure that we support meaningful engagement. So what is the role of IANASO as the Anglophone Africa platform to further efforts towards community engagements? I know there was already a question someone was asking about how to access capacity from IANASO to support in regional and country proposals. So as I'll be explaining for you, I believe I'm going to answer your question. So one of our role as IANASO, as the host of the Anglophone Africa platform, is to enhance knowledge and participation of civil society and community groups in global fund related processes. And we do this through communication, provision of accurate and accessible information. So what we do, we all know that the Global Fund has policies, guidelines, strategies, and these are very big documents. And Africans, we really have a challenge of reading. We don't pay attention to details. We don't have time to read those big documents. So what IANASO does is to repackage those documents into community guide, summarize them, and even go ahead to do translation into Portuguese, translation into Swahili, and ensure that these documents are summarized and packaged into community guides so that communities can access information on Global Fund processes. We also do webinars, like for example, this webinar where we provide information about the Global Fund, trainings to communities and civil society. We have newsletters, and I think from this webinar, we'll get your contact and be able to add you on our database, MailChimp, so that you can subscribe to our newsletter and receive information on Global Fund and even other partners. And also on social media, we have Anglophone Africa WhatsApp group, where we share experiences, we share information. I mean, these are very great platforms where we can really share information about Global Fund processes. And I think after this webinar, we should get your contacts and be added on that group. Secondly, we do expand access to technical assistance for civil society and communities. This is what Reece talked about, the role of the regional platforms. We really do a lot in demand creation to ensure that communities have knowledge about CRG technical assistance, to ensure that you access TA, and we go ahead to support you during the TA request to give you that technical assistance, to support you to come up with quality technical assistance request before submission. So this is something that we also do in collaboration with the Focal Point organization. And I just want to say that there's not been a lot of malaria communities accessing TA. So this is a great opportunity for you guys to reach to us so that we can support you to access TA. There are a lot of opportunities, as Brice said, especially during the fund request development processes that all countries have been submitting the proposal. This is very key for the malaria communities to access TA so that you can be able to engage in fund requests, in writing processes, in grant making, and even after grant making during the Global Fund implementation. It's very key for you to access TA. The next role is we strengthen civil society and community groups capacity to effectively participate in midterm reviews and national strategic planning processes. So we all know that the NSP processes, it is very key for civil society and communities to be part and parcel of the processes, and also during the review of the national strategic plans for HIV, TB, and malaria. So the platforms also do play a very big role to support civil society engage in these processes, especially bringing out the component of community rights and gender, human rights programming and intervention to ensure that they're incorporated in your national strategic plan. We also do support facilitation of civil society and community groups to develop CSO national priorities with aspects of human rights and gender and community system strengthening and engagement in the global funding request development. Right now, we are supporting 8 countries in Anglophone Africa during the Global Fund request development. For example, we are supporting Nigeria, Zimbabwe, South Sudan, Rwanda, a lot of countries. And if we don't support those countries, then we link the communities and civil society to access TA to be able to engage in these processes. We also provide platform avenues forums for civil society and community groups to exchange information and share experiences across the region. I know some of you have ever attended our platform meetings. We normally have annual regional platform meeting, civil society, CC, dialogue forums, principal recipient implementers meetings. So these meetings will bring together civil society to share experiences on what they are doing, what are the challenges, and also share best practices. I'm told my time is limited, so I'm going to quickly go through this. Support civil society engagement in processes related to sustainability and transition co-financing and domestic resource mobilization. I think Gemma also talked about it. There is a sustainability transition co-financing policy from the Global Fund, and so it is very key for civil society really to engage, especially in sustainability. Hello, Mlewa, kindly mute your microphone. Thank you. Yeah, so it is very key for civil society to engage in sustainability planning, especially during the national strategic planning, and to ensure that there is, as we all know, that this Global Fund is not there to stay forever, and so we need to come up with a sustainability plan for future. Also transition, there are some countries that are transitioning from the Global Fund funds, for example, like Eswatini is transitioning from malaria grants. And so it is very key for also civil society to have this knowledge, as well as the co-financing and domestic resource mobilization. Undertake a research study on Global Fund grant performance and absorption capacities to ensure communities and civil society play a vital role in grant design, implementation, and monitoring needs assessment. We do a lot of research studies to ensure that we provide information and data to the community so that you can be able to influence decision during programming and design of the Global Fund grants. Development and sharing of tools and guidelines. As Gemma has already said, we do develop a lot of tools and guidelines to strengthen the capacity of civil society and communities to engage meaningfully. If you go on our website, we quite have a lot of guidelines. For example, we developed a guideline on how to support civil society effectively engaged in grant making processes. This is a very good guideline that can strengthen the capacity of civil society to meaningfully engage. We have other tools for TB. We have one Impact app. We have Spot TB app. Yeah, so kindly visit our website so that you can be able to access these tools and guidelines. We also have a mapping link where all civil society working malaria, TB, and HIV have been able to register, and having this database is very key for us. So kindly visit that website so that you can register your organization and also be part of the IANASO database. So these are some of the examples of community guides that we do develop. You can see we have a community guide to the Global Fund Sustainability, Transition, and Co-Financing. It's just a 4-pager or 3-pager community guide. We have a community guide to the Global Fund Strategy 2017-2020, and this is ending very soon. So as I've already told you, there is a process of the developing a new strategy, which will begin 2023. Then we have a community case management for malaria, understanding the anti-malaria treatment policies. So these are just samples, but we quite have a lot of community guides that we do develop, and just kindly visit our website so that you can get this information. And we also do translate them into Portuguese and also some other languages. So for more information, please do contact us on this email, website, Facebook, Twitter, and Instagram. Kindly visit our social media so that you can get more information. So thank you so much for listening, and I'm happy to take your question, but I'm also happy to hear your ideas and suggestions on how we can engage more malaria communities. Thank you so much. Over to you, Mlewa.
Thank you so much, Yvonne, for that presentation. And I'm sure it has opened up quite some good understanding for some of the questions that colleagues had as well about ENASO and how they can support. So now I want to ask Olivia to come in and talk about the civil society malaria elimination platform.
Thank
Olivia.
you very much. Yes, thank you, Marwa. Thank you very much also, ENIASO, for the great presentation. So you've heard earlier about technical assistance providers, about community-wide and gender strategic initiative opportunities provided by the Global Fund. So we at CS4Me, we are working on driving the demand so that ENIASO and others can continue to provide that technical assistance for civil society engaged in malaria. And like Gemma said this morning, malaria CSOs are not really yet fully taking advantage of all the opportunities that are available to them in terms of free technical assistance and in terms of capacity building. So we really believe that even like Bryce said earlier, there was an increase of malaria organization as demanding technical assistance from 0 to 14, but we need more than 14 because we know that there are a lot of malaria CSOs who can benefit from that technical assistance. So our goal is to really help to drive that demand. So who we are the global platform, a very new one, a very recent one. We were just launched last year in 2019, and we have already about 280 members in 43 countries. So we are very new, but we are also very ambitious, very bold, very, very, very aggressive in terms of what we want to do. So we are the civil society for malaria elimination platform. And our goal is to unite civil society and community to achieve malaria elimination. So we realize that we cannot talk about malaria elimination if civil society and communities are not fully and meaningfully engaged and do not do not contribute to a malaria program the way it needs to be. So our vision is a world free from malaria. And our mission is to make malaria programs and interventions more effective, equitable, innovative, inclusive of civil society, community-based, human rights-based, gender-sensitive, and adequately funded. So it's quite important that now when we talk about malaria, it's not just a disease that is a problem of the Ministry of Health or a problem of the medical doctor. But when we talk about malaria, we really have to talk about gender issues, human rights issues, community rights issues, social issues, all the other factors that actually affect access to malaria services. And I think a lot of people have also said this morning, asked questions about community usage of mosquito net, how do we convince them? So this question, we shouldn't even be asking those questions now, because if communities were engaged when the malaria communication strategy or programs were elaborated at first, then those community representatives will be able to actually tell the service providers what challenges they face in terms of using mosquito nets, so we can actually so that the country can develop strategic communication campaign that actually address those challenges. So this is exactly the problem, is that for the longest time in malaria, communities and civil society were just considered as beneficiary, and or even sometimes are service providers for community health as community health workers. And they were only contacted when it was time to distribute net or when it was time to provide any type of services. So now what we are saying with CS4Me is that you, civil society and communities, then have to be engaged from the beginning at the decision-making process, from the beginning when the programs are designing, to the implementation, to the community and monitoring aspect of of those programs. And we saw with Ayo yesterday from Nigeria, he spoke about community-based monitoring in malaria and the great work that they are doing in malaria to make sure that malaria programs actually reach the most vulnerable in Nigeria. So we have to be engaged more meaningfully at all stages and as equal actors in this fight, because if you are not engaged, we will continue, our countries and our partners will continue to spend a lot of money buying a lot of mosquito net that communities end up not using properly. So we have to make sure that we encourage communities to use those mosquito net and all those tools properly, because for right now, it's the most effective way to prevent malaria. The most cost-effective way to prevent malaria is the treated mosquito net. There's nothing else right now at the moment. So we need to make sure that we use those tools very effectively. And this goes through strong civil society and community engagement from the beginning all the way to the end. So our goal is to connect malaria civil society into a single global platform, and also to encourage South-to-South collaboration, a little bit like what we are doing today with ENEASO. We have partnered with ENEASO to organize this training. This is South-to-South collaboration. And we also have WhatsApp groups where our CSOs are all connected from Francophone, Anglophone Africa, and also Asia. And earlier this year and last year, we've done a lot of meetings and webinars where for the first time in the history of malaria, and malaria has been around since ever. So for the first since the beginning of the world, I think. But for the first year, we have CSOs from Asia who were able to share the experience with CSOs from Africa and back and forth. And that sharing of experience was actually very, very well. And we want to continue that. So we also want to increase information and sharing knowledge about malaria strategies and new findings. So celebrate what we've done and what we are continuing to do with WHO, with Global Fund, with RBM, with other partners. We also in-country partners and African solutions to those malaria issues. So we hope to continue to increase knowledge of CSOs around malaria strategy, because you have to understand the strategy. You have to know your national malaria control, your national malaria strategic plan. You really have to know that if you want to sit at the table and discuss and actually be heard. But in order for you to do that at the civil society, you need to know your national malaria strategic plan. It's very important. Then we also want to, like I said, strengthen capacity of CSOs, provide trainings, involve CSOs in decision-making in many spaces. So we have encouraged malaria CSOs to join the national CCMs, the national governance system, the Global Fund, NGOs, delegations. Any instance that we see, we think malaria CSOs can be represented, and we need to increase their voices in those spaces. And we also want to work with all of you to really reinforce the sense of urgency to eliminate malaria. It's really urgent. It's as urgent as COVID-19 to eliminate malaria, because it's a disease that we can prevent and we can treat in 3 days for simple malaria. So it's not acceptable that we still have anybody who died from a disease that you can treat simply in 3 days. So it's not a disease that is complicated to treat. We have the tools to prevent it, tools to treat it. So we don't understand why we have to lose still our children, our mothers, our brothers and our sisters from a disease we can prevent and treat. So we really have to reinforce the sense of urgency to knock out this disease quickly. And this will be done with the voices, or with all of your voices as civil society organizations. And of course, we want to advocate for sufficient malaria funds and allocation for civil society and community-led interventions. I think many of you spoke about that yesterday when you asked Shushu, how can malaria CSO access funding? So we want to advocate for increase of funding for civil society, not only for the Global Fund, but all the partners, but also most importantly, our own countries should start to invest more in the fight against malaria, and also civil society and communities intervention. But we know this is just between us. We also know that if we want to ask for more money, then we have to make sure that we are able to receive that money and we are able to be accountable and we are able to have, and then we have strong organization and strong processes that can actually deliver project with the funding that we're asking for. So we will be advocating for more funding on our, from malaria CSOs. And we also hope that on your side, you will be working to strengthen your capacity to be able to actually access those fundings. So it's actually a lot of work that we need to do, but we can do it. And we believe that it's time to have more local civil society organizations be implementers of malaria programs everywhere, because they are the ones that who actually know the context, the communities, and they are the ones who are constant and will never leave that community. So we think that it's time to really invest more on malaria civil society working on malaria. So, and then of course, keeping our leaders and ourselves accountable, because we all have to be accountable for the work that we do. And yes, so CS4Me was created last year. We are still in the process, still recruiting members. We are happy to have members from 43 countries, and we will also request and hope that you share the information about the network to all your colleagues who work on malaria, so that we can together join forces and continue to advocate. So this is just some of the activities we've done last year. In our first year, we've done a lot of, for the first time also, we had a lot of malaria organizations who raised their voices for a fully funded global fund, and really and doing a lot of in-country activities to really say that it's time to eliminate malaria. So this is the work of many leaders, not just Olivia that you see, but there are many leaders from many countries. There's Ayo in Nigeria, there's Cecilia from Ghana, there's Noriet in Rwanda, there's so many leaders that are part of CS4Me who are actually making this happen. And we are very grateful to them, because this is the beginning of a new movement, and it's a movement led by civil society and community affected by malaria in Africa and in Southeast Asia. And we are really engaged and committed to this work, and we hope that we will be able to engage many more of you on this platform. Please join us as members, join our WhatsApp group. Let's continue the conversations, be a part of our trainings. And also we hope that we will be able to continue to build this strong, unique, and a single malaria global movement for civil society and for community. So it's just the beginning, but we are getting there. We think we're gonna get there. We only have 1 year of existence, and we also thank the CRG department for helping us to be able to launch this first year. So I'll just show you a quick video from our members, and then that'll be it for my presentation. Thank you.
People who live in remote areas, orphans, and street children. Every 2 minutes, a child dies of malaria. That is, over 250,000 children could not see their 5th birthday because of a mosquito bite.
These people needlessly carry the burden of a preventable and curable disease.
In Africa, malaria is now the leading causes of death, and when transmission has a significant impact on the economic and social attendance.
Okay, thank you very much. So those are just informations that you receive about how to join the network, and you receive all of this in the email after the training. And we are really excited to launch this new movement and to start this journey with all of you. Thank you very much. Merwa, back to you.
Thank you so much, Olivia. That was an interesting video. The sound wasn't very audible, but I'm sure guys have enjoyed, at least for the sections that the sound wasn't audible, they have been able to read what was actually being said.
Yes, thank you, Melwa, back to you. Thank you.
Thank you so much, Olivia. So we actually have spent 2 hours now, but I will want again to give like about 10 or so minutes for any questions that people might have on the 3 presentations, so that we can also be able to allow Brice, Yvonne, and Olivia to respond to any questions that participants might have. So Olivia, from your side, if you can see any hands, then that will be okay, so that you can invite them to ask questions.
Okay, thank you. Sorry, we don't see any hands up, but we'll look in the Q&A box to see if there are any questions for either Brice or Yvonne or myself. So we also see that Brice has already answered to many of the questions that were in the Q&A.
Yeah.
So thank you, Brice, for doing that. So everyone, if you look in the Q&A, you can see the questions and you can see the responses from Brice already. I will just give you an example from Cecilia. What is the period for long-term and short-term technical assistance? And Brice responded that short-term technical assistance was 30 days, and then long-term is in nature, and it depends on, there's no time limit for that, I think. So if you look at the answer box in the Q&A, everyone can see the questions and the answer that Brice already provided to everybody.
Thank you, Olivia. If I may add, yes, so I tried to answer some of the questions.
And questions around how to be part of the CS4Me WhatsApp platform. Yes, just send us your phone number, we'll add you, but first you have to go on the website, cs4me.org, apply to be a member, and then you will receive the links to all the WhatsApp group, and then you pick the ones you would like to join. So it's very easy, cs4me.org, and apply as a member. Thank you. So I don't see any hands up, which is great. I think everything was very clear. But like we say, if you have any questions, you contact Aiza or Enyaso after, and we'll be happy to direct your questions to any of the speakers. So Merwa, back to you.
Thank you very much. Thank you very much. Yes, Yvonne?
Yeah, there was a question before I presented. I think it was how to access capacity from EANASO to support civil society in the country proposals. And then there was also someone from Kenya asking how to access TA. So just to say that EANASO, please reach out to us in case you want to access TA, so that we can support you during the TA requests. We can give you ideas, we can support you to ensure that you submit quality TA. And this is the right time, especially countries that have submitted their fund requests in window 2 and they are receiving TRP comments as well as going into grant making. So this is an opportunity for the malaria communities to access TA, to engage in grant making and also in TRP comments, and also for the window 3 countries that are submitting the fund request. This is an opportunity to access TA. So reach out to us, we can support you and give you more information. Thank you.
Thank you, Yvonne. I had also typed the contacts in the chat box for people who actually really need to reach out to EANASO. They can reach out to either Yvonne, Mlewa, or Olive. So I've also provided that information on the chat. So feel free to reach out to us just in case you are in the process, your country is in the process of fund request, we can see what type of TA that you actually need to do and support you to do a quality TA. But it doesn't end there. After fund request, there is grant making, as Brice has just explained very well. This is also another opportunity for civil society to engage, especially responding to TRP comments. And of course, towards the process of grant implementation, there are also other processes that civil society may need to engage. So feel free to get to reach out to us, and we will actually guide you on developing a quality TA. We'll send you the TA request form so that you can be able to make use of that facility. Otherwise, thank you very much. Presenters, Gemma, Brice, Yvonne, Olivia, you've done a really good job. And this has been a really, really well enlightening session for malaria communities. This is not the first and the last, but we hope to have many more of these. In the next 1 week, we'll actually be having the same kind of training again, but in French. So for those of us who still can be able to interpret French, you are also welcome to still learn more on this training that will actually be reaching out to the Francophone countries in Africa. So I would wish to say thank you very much for having stayed with us all that long. I know 2 hours is not a short time, but I can see we still have over 80 people still on the call, and this is really good. We really appreciate. We don't take this for granted, but we know you have sacrificed so that you can be able to learn about how best malaria constituencies can engage in global fund processes. So I would wish to say thank you very much. Have a nice afternoon. Take care and be good, and let's keep the conversation going. Bye-bye, everyone.
Bye-bye. Thank you, Mulenga.
Thank you, Mulenga, for such a great moderation. Thank you. You were awesome. Thank you very much. And our next trainings will be coming up soon, early September. We will get back to you together with ENEASO. Thank you so much, everyone.
Thank you, Olivia. Thank you very much. We really appreciate your leadership as well.
Thank you very much. Bye, guys.
Thank you, Grace.